How do doctors treat fifth disease in children? Imagine a child with bright red cheeks that look like they've been slapped. That's a classic sign of fifth disease, a common viral illness in kids caused by parvovirus B19. Most children with fifth disease feel pretty well, and the illness usually goes away on its own without special treatment. Doctors focus on helping children feel comfortable while their bodies fight the virus naturally. When a child shows signs of fifth disease, doctors usually diagnose it based on the appearance of the rash and the child's symptoms. The bright red rash on the cheeks, often called a slapped cheek look, is very distinctive. After that, a lacy pink rash may appear on the arms, legs, or sometimes the chest and stomach. Usually this rash is enough for a doctor to make a diagnosis. Sometimes, if there are concerns about complications, or if the diagnosis isn't clear, blood tests might be done to confirm the infection. Since fifth disease is caused by a virus, antibiotics are not helpful and are not used. Instead, the main goal is to make the child comfortable and help relieving symptoms. Doctors often recommend encouraging the child to drink plenty of fluids to stay hydrated. Over-the-counter medicines like acetaminophen or ibuprofen can be used to reduce fever and ease discomfort. It's important to remember that aspirin should never be given to children because of the risk of rash syndrome, a rare but serious condition. If the rash itches, an antihistamine might be suggested to help with the itching. Most children recover fully within 1 to 3 weeks. The rash may come and go for several weeks, especially after exposure to sunlight, heat, or exercise, but this doesn't mean the child is still contagious. Once the rash appears, children are usually no longer able to spread the virus and can go back to school or daycare if they feel well and do not have a fever. Children with certain health conditions like sickle cell disease, other blood disorders, or a weakened immune system may be at higher risk for complications. In these cases, doctors might monitor them more closely or provide additional support, which could include hospitalization or special treatments if severe anemia develops. Pregnant women who have been exposed to fifth disease should see a healthcare provider because the virus can sometimes cause serious problems for the unborn baby. There is no vaccine to prevent fifth disease, so the best way to lower the risk is through good hygiene. Regular hand washing, covering the mouth and nose when coughing or sneezing, and avoiding close contact with sick people are helpful. Doctors always advise parents to seek medical advice if a child with fifth disease has a weakened immune system, high fever, worsening symptoms, severe joint pain, or signs of severe anemia like unusual tiredness or pale skin. Most cases are mild and don't need special treatment, but it's important to get professional help if symptoms become severe or if the child has underlying health issues. Remember, always consult a healthcare professional for personalized advice and care.